I would probably say to anyone that asked me, what kind of relationship did you have with your wife for 38 years? I would probably say, I don't think you could have a better one. We had a wonderful relationship. We were best friends. Margie and I did pretty much everything together. We were very lucky. We lived at a lake. Literally, our entire lives centered around being there. I mean, in so many ways, I would have to say that. I mean, we really had the perfect life. Margie and I got married, I think I was 25 and Margie was 21. You know, you say these vows for sickness and in health, and you have no idea what that means. You know, when you love someone, it's easy to do things for them because you want to do things for them. You want to help them in any way they can. And I want to do everything I can for her, but you know, there's just, I hate to say it, but there's something missing that it's irreplaceable. I can't go back. Excuse me. Initially, we were treating her for depression and anxiety, but it was my daughter who kept saying to me, "Dad, this is more than that." We started going to doctors and seeing what's wrong. That was in February of 2010. She was 53 years old, and the result of that was she was diagnosed with early onset dementia. Even though we suspected it, just to hear, that was very painful. Those next few years were so difficult. She had gotten so bad that she really couldn't be left alone, for fear that, she would leave the stove on. She was beginning to have difficulty dressing herself, beginning to have difficulty bathing herself. I have been retired for 2 years now, taking care of her full time. I don't want to put this on anybody else. This is my responsibility. But no matter what, there's still tomorrow. And tomorrow is going to be pretty much the same as today, only a good chance there's going to be something a little worse. From February of 2010 to this day, she has really been on a straight downhill. When Margie is here, she could be sitting right next to me, and I can still feel alone. I mean, living with someone who you can't communicate with, who you communicated with your entire life about everything. The lake house became unmanageable for us, especially for me in terms of my caregiving duties. So moving into a retirement community just made perfect sense for us, and it simplified things. And then when I'm reading in the newspaper about a United Way Caregivers Coalition meeting, and it is literally right at the end of the street, I was elated, because that was going to be then the first time for me that I was going to reach out to anyone other than family for help. So discovering the United Way at that point was almost like a destiny, to discover this at this point in my life. Sitting around at this coalition table, were a number of organizations and a number of people, other resources. There were other places that I could turn. That was the first time that I experienced any kind of almost relief, this recognition that there really is help out there. To be able to meet with other people that have understandings that are very similar to my own, and to be able to continue to meet with them on a monthly basis has been extremely helpful. whenever I project out into the future, I know this thing isn't going to go away. It's not going to get better. But what does get better is the opportunities to interact with people who do understand what I'm going through and their willingness to help. And that's a beautiful thing and extremely important to a caregiver.
At United Way, we know what the community needs, and right now we need you. Let's live united.